So, Fred, a little bit about you. I know you worked at the health centers and Erlanger Hospital, but can you tell us about your childhood and what inspired you to pursue nursing?
I was born at 635 Maple Street Court, in the house at 635 Maple Street Court, on April 23rd, 1946. I realized very early that I wanted to serve people. I had two brothers and two sisters, mom and dad, and unusually now, we all lived in the same house. I liked working with people, serving people. I always knew I was supposed to go to college. And I didn't know how, and we were as poor as vestry mice, but I knew I was supposed to go somewhere or another. When I started to college, well, I graduated from Howard School, went to Second District Junior High School, went to West Main Street, the elementary school.
And two of those don't even exist anymore.
Right. And James Lee Henry. Went to Second District Junior High, went to Howard, graduated from Howard in 1964. Got a scholarship to Lane College in Jackson, Tennessee. So went there, came home at the end of the year, and my mama and daddy needed me at home. So I got me a job at Memorial Hospital. Worked there as an orderly and enjoyed that. And I had initially, when I got to Lane, I was going to major in English because I thought I'd teach. But they offered a scholarship at Memorial. It was $750 a quarter. And being as poor as we were, $750, I bought a couple of air conditioners and stayed home. I went to work, stayed here in Chattanooga, and with that scholarship, I went to Cleveland State Community College. I got an associate degree in nursing there. And it was several years after that I got my bachelor's degree. I have worked pretty much anywhere they let a nurse work. I've worked at Memorial, I've worked at Erlanger, I worked at Tri-County for a while. When they opened Park Ridge, shortly after that, I went to work there for a while. My most extended stay was at Erlanger. Okay. I did medical surgical nursing there, cardiac nursing there. Worked as a nurse reviewer at utilization review. I worked at Alta Park Health Center, that was my best experience. It was just wonderful taking care of those people.
Well, and I know you when you was at Alton Park.
Right.
And of course, that's when I thought you first got into nursing. Evidently, you had been into nursing before that.
Yeah.
So what led you to work at Erlanger? And tell us, how long were you there? Because you seem to have been one of the lone-serving nurses at Erlanger. Because Erlanger was associated with the health centers also.
Right. That's really how I got there. I was working at the health centers, and I was working at Erlanger first. And some openings came at Erlanger. And I think Joanne said she was going to Erlanger, and she suggested that I take a position there, and I did.
When you said Joanne?
Joanne Favors.
Joanne Favors, okay.
Yeah. Mm-hmm. And so I went to work at Erlanger. I worked at several different areas there. It seemed that I did bedside nursing primarily initially. And my last years there, I worked in utilization review, reviewing charts, to make sure the documentation was as it should be for adequate reimbursement, right, and that kind of thing.
Okay. So as the first African-American male nurse in Chattanooga, what were the biggest challenges you faced entering this particular role?
I really didn't have a lot of challenges because when I came along, it was, they were glad to get a male nurse, black or white. They were glad to get a male nurse. Until what I had to do was when I got into this, had to help them to understand my role was not to lift patients only, you know. And so, and you learn to get along with people. If you get along well with people and help them to understand we're gonna work together, you don't work for me. Right. You know, we'll work together. And I have never worked anywhere that I couldn't go back again or that I had not been called to come back whether I want to go or not. Right. Yeah.
So can you describe a moment or experience at Erlanger that felt particularly meaningful or historic to you?
I was very active in my church. I did directed choirs and things like that. And I had a problem sometimes having to work on Sundays. And I was giving this man a shave. He said, you know, Fred, I got to get out of this hospital. I said, okay, what's the rush? He said, I need to go to church. I said, okay, what you going to church for? I need to be saved. I said, oh, we don't have to go to church for that. We can do this right here. He said, you sure? I said, yeah, you can. So I helped this gentleman come to Christ. That was the most beneficial experience I ever had in wherever I was, in a hospital. I'd have coworkers, children call me to say, Mr. Fred, tell my mom I'm going so-and-so. They would even tell me their names. I heard them so much, I knew who they were, you know. I made efforts not to write ugly and unnecessary things on coworkers' records. Often there are reasons why they act like they act. And once they understood their role, you know, we're here to take care of the person and whoever else is with the person. It might be their neighbor. I was able to work with some of the young residents who didn't understand that if you're talking to this older person and they don't want to have the surgery that you want them to have, they might have a dog at home that they need to go back to. And you wouldn't understand that. You don't understand that they don't have the income you have. Right. You know, and as they're older, they'll pay bills and starve sometimes. You know, so I enjoyed that. Yeah.
So during the time that you got into nursing, it was also a time that African Americans were moving into other areas of leadership in the hospitals and other companies, corporations around Chattanooga. You were, like I said, you were the first African American nurse here in the city, but you also were someone that people looked up to, and of course, being that type of person, how did your colleagues, patients, and the community respond when you first began to work at Erlanger and doing that nursing series?
What I realized is that very often people will think that you think you're better than anybody else, and it's incumbent upon you to pull them in, to let them know I'm the same person. Yeah, we can talk about whatever it is. It got to the point that they would go to the doctor and come back and ask me, what is this, Fred? Should I take these pills? That kind of thing. And you would have to encourage them to listen to the doctors, you know, to go to the doctor. I had one young lady, I think they were giving mammograms, and I was telling them the importance that you're going to have to go to this. This is what I told them, which was not true. I said, if you don't go get this mammogram, I'm going to write it on your record. And I'm going to write you up. And now you know I can do that. But anyway, they went. And when the results came out, this young lady came to me and jumped up around my neck. She said, Fred, they found something on the mammogram. I wouldn't have gone if you hadn't made us go. And I told her, I said, you know, I really couldn't make you go. I just knew you needed to go, and you would not have gone if I had not encouraged it. Right. So those kinds of things, You know, I'll see people on the street and they tell me things that I did. Now, when did I do that? Well, remember, I was working at you were working at the health center then. Then I came to the hospital and I saw you there. You know, I remember the health center had this man that would come and bring his medications. He always brought them in a pocketbook. Always put them in a pocketbook. And we'd have and often he'd have medications like Lanoxin, and he'd have digoxin, which is the same thing. And he wouldn't know the difference. You know, he would not have told them that I have been prescribed this before. So those kinds of things, you know, you try to get it in places where you can give others the opportunity to work in the hospital too. You have interviews and you tell them, sometimes they come to work and you think, you know you can't stay here like this. I'm gonna be okay. No, you go on back home. You come in tonight at 11 o'clock.
So, and of course, you talked about the health centers just now. We're going to expound on that a little bit because when you were at the health centers, you became one of those nurses that everybody looked up to. The kids come through the health centers, the older people come through the health center. And you talk about the gentleman that brought his medicine in a pocketbook, but most of those older people that came in the health center, because I would see them in the end because they had to be.
Right.
But when they came through the health center, they had these bags, and some of them have 10 or 15 prescriptions. Because one of the questions I used to ask the doctors and the nurses, how do they know what's helping? And you were one of those that people would trust. So talk a little bit about your experience at the health centers and how you were able to get people to have faith in you and trust in you to be able to talk to them about the things, just like you were talking just a few minutes ago about how they would come to you and different things. But expound on that a little bit, because that was very important in those days, because the health centers were very new coming online, and the things we were doing at that particular point in time was even newer, especially to African Americans, because their health care at that time had not been the thing that they took care of mostly.
Right.
And when the health centers came online, it was very important for people like yourself to be able to gather those people in and encourage those people. So talk a little bit about how you were, and of course you were in Autumn Park in that area. So talk a little bit about that kind of thing.
My wife and I were about to have our first child. And there was a lady, chubby little white lady, just as sweet as she could be. She came over there at least 2 times a week to bring me something that she had bought at Family Dollar. I knew she couldn't afford this. I would take it anyway, tell her how much I appreciate it, and I did. I made efforts to show no partiality race-wise. If your blood pressure is high, whether you're black or white, you have to accept people where they are. And you have to be sure that they understand that you care. You know, we sit down with medications. This little man, we pour his I take him back in the break room. We pour his medications out on the table. And I said, now, come on, tell me what you're taking. Well, he wouldn't know, you know. So I would separate the medication and say that this is what you're going to take home. And this medication, we're going to have to leave this here, because it's pretty much the same as you're taking right there. So remember now, they're separated. They're not the same thing. They are the same medications, but you're not supposed to take them both. You just take this one. I tried to carry myself in such a way that they would be respectful, but you can't act like you're better. And most of the time, you know these folk, because we go to the same churches, you know. One guy came in, we went to high school together, and he had bad hypertension. And we were talking, I was telling him about what foods you should avoid. He said, now Fred, I may as well just tell you this. I like pork chops. I'm gonna have pork chops at least twice a week. I said, can't you just cut that down to maybe once a week? Fred, I'm telling you, I'm going to eat my pork chops. Okay, I had to take that and go right on along, because he wasn't going to change his diet, you know? And you have to understand, okay, this man is as old as I am. He doesn't know any other way. You know, this is what he was raised on.
And that's where you had to use strategies and things of that nature.
Yeah, yeah.
To deal with people like that, because that was the way things were. And,
right.
And of course, like I said, the health centers were new.
Right. And at the time, I think Marianne Effiam was the nutritionist. And I talked to Marianne and said, Marianne, this is what we got going on. So you might need to see this person maybe twice a week if you can. And we kind of work like that, you know. It was a challenge, but it's one of the most rewarding situations, because they would trust you and they come to the health centers knowing that they didn't have the $3 or $5. They knew they didn't have that. They knew that we would work it out some way. You'd have to call them. You know, you're supposed to be here. You know, your blood exam requires that you don't eat. One lady come in and she said, I didn't eat much. I said, you're not supposed to eat all. I just had one sausage. I said, no. And I had just had a little bit of biscuit. I said, but I didn't put a lot of sugar in my coffee. I say, that's not the way this is supposed to work. But she didn't know better. There's one lady who come in every month to get her water shot, and it was nothing but plain old still water. But she felt like it was keeping her alive. So that's what she got.
So tell me, have you been involved in mentorship, outreach, or efforts to recruit more men and people of color into nursing? And if so, can you share any of those examples?
Yes, I have. And it's during the time particularly when factories were beginning to close. And there were young men you see, and they had the ability to do that. And I tell them, I say, you know, I have left jobs, didn't go to apply for another job because I know they're gonna want me to come back to work that day. I said, you can make a good living. And I explained to them all the things, what nursing involved. You didn't always have to take care of folk at the bedside. You could move to other areas of nursing. You could vary your shifts if you want to. It got to the point where we were working like 12-hour shifts. You work 12-hour shifts, 3, and you're off. I said, you can work 2 different hospitals if you want to. You know, you don't have to be out of work. I'm thinking there were 2 young men that got into nursing and they were not doing well. I had an opportunity to talk to the nursing instructor and to share with them that they're having a hard time, but they told me that they're not able to contact any of the instructors to get additional time. And they did. One of the young ladies had applied to the nursing program, and she hadn't heard anything. So I told the instructor, I said, she's applied to your program. She has. I said, she hadn't heard anything. Okay, Fred, I was looking at that. She got in the program, she's a registered nurse now. So you have to try to be the kind of person where people who are doing the hiring will listen to what you say, you know, right. And understand they didn't hire you to run the hospital. They hired you to be the nurse at the bedside, make them aware of issues that were a problem. I could work with physicians who, I was working with this one physician, he said, we need to take the vital signs every 15 minutes. I say, we can't do that. Well, why can't you do it? I said, because we don't have the staff for that. That's not what we do. There's a department where they do that. And he said to me, does Miss Pelletier know? I said, Miss Pelletier doesn't get on the elevator to come to work. That's why she put me up here. Her office is downstairs. I said, They do it on other floors. I say they tell you they do it on other floors. And if they do it on the floor, something's going on wrong. Well, what can we do about it? I said, the first thing we can do, we can put the patient in the right place. There's a recovery room for what you want. I said, I know what you want. We can't do it. And I shared with him my patient load that day. I said, I can't do anything every 15 minutes. I said, I can't do that. So he said, what can we do? So we developed a plan right there for what he needed. You know, you have to, I would be off from work. They would call different departments and say, Fred said blah, blah, blah. I wouldn't even be there. I said, don't do that. That makes it bad for me. You know, I'll do what other departments want if I can. Okay. You know, you have to work cooperatively.
You, Fred, at the time that you went into nursing, you worked with some historical black nurses, people like Miss Tull. Mm-hmm. And of course you mentioned Joanne, and I don't know whether you worked with Miss Carter, Ernestine Carter or not, but at that time that you were working with these, and I say historical nurses, Melanie Smith comes to mind, and things of that nature, because some of these programs that were started at the health center was new programs. Mm-hmm. And those programs came online actually because of those people that were involved at the health centers.
Right.
You were part of that. And as being a part of that, talk a little bit about how you feel your presence influenced patient care, workplace culture, and even conversations about diversity, especially at the institution at Erlanger.
One of the requirements I learned was had to make efforts to be the kind of nurse where they would ask your opinion. Sometimes you'd have to share your opinion with somebody who might be white and let them get the credit. And that's fine. I would often encourage nurses who work like in ICU to maybe, why don't you come to the floor and work with me? I said, you're taking care of one person. I got 6. Come work with me one day. Came, they might stay about an hour. I said, do you see what we are going through on the floor? If you can, let's talk and see if we can get some organization about this. So you call and you want a bed now. I can't give you a bed now. And even if I give you a bed now, there's somebody waiting to come to this bed. Mm-hmm. And see, just because they're gone doesn't mean that I'm through with them. I still have the record to complete. You have to be willing to compromise. And not your standard, but understand you're dealing with people who don't understand your race. They don't understand the sacrifice that was made to send you to school. Or the fact that you went to school and you worked full time. Those kinds of things. And you had to understand that was your responsibility, not theirs. It's kind of let them know it's not as easy as you think. When I working with Milanese was an experience. She had been through so much, and to get where she was. And she and Joanne particularly made efforts to speak up for those who are at the bedside, which is the hardest work, to say, this is what's going on. There are things that we see that we know is different. We notice that when this patient has pain, you might order pain pills, but this one has the same pain. You order injections. Okay, now what's the difference? Why not? And you don't broadcast it, but you just go to this doctor and say, can we do this? Doctors are human. Right. When they make mistakes, you don't just tell everybody. You correct it, and they'll appreciate it. I could call a doctor's office and pretty much get anything I wanted. within limits, because they trusted me.
Okay.
Yeah, it has been a challenge, working, and as a African American nurse, you learn to cover your person's back. Sometimes school will teach you this. Okay, they'll work for this person. They ain't gonna work for you. So this is what you better do. And you be sure if you call so-and-so, if you don't document it, you didn't do it. So you have to document it. Yeah.
Okay. Yeah, and so when you say, as an African American nurse and working in that field, you have to learn to cover one another's back. That sometimes becomes difficult.
I find if you let them know this is for you, and you can't exemplify this right now, but the whole time they're there. Say when they'll call you and say, Fred, they're calling me from school. And my little girl, blah, blah, blah. Okay, don't check out. Go on and come right back. If you can't come back, let me know. But come on, it's snowing. I got a full staff. Now, I might have picked up 3 of them, but they'll come because they know I'm going to do all I can to make it okay for them. And they would, when they understood, they didn't work for me. We worked together. That was a dessert that I liked. Sometimes they come from the cafeteria. I have 3 of them. 3 people have brought this because I know Fred like this. Now, when we had our child, the first at that time, they threw us a shower. That was just amazing. I thought, where did these folks get all this money? Some of that stuff we still have today. It's the way you treat people.
It's all about treating people right.
It's the way you treat people, and you have to work. And as a nurse, you have to try to stay up on. Now then, they didn't have medications like they do now. Right. They didn't have as many. But you'd have to stay up on that kind of stuff and read and encourage the staff to read and set up staff meetings and that kind of thing. It was enjoyable.
So what advice would you give to young men of color considering their career in nursing today?
I try to first encourage them to read about nursing, find out about nursing. So most of the time when people think nurse, they think people working at the bedside. And I share with them I think the last 15 to 20 years of not the last, in my nursing career, I didn't work at the bedside. My last years, I worked as a school nurse in Hardy Elementary. That was good. But I would tell them the advantages. I mean, there's so many things you can do. You can work at the bedside if you want to. You can work in the GI lab. You can work in dialysis. You can work in home health. There's so many things that you can help write manuals. And I was told that now at one of the insurance companies, they only hire nurses with bachelor's degrees. Okay, so if that's what you want to do, you just can't stop your 2 years. And it says it's a 2-year program, but it's really more than that because the first year is academics. And whether or not you get into the nursing program depends on how well you've done in your academics. And then it's 2 years after that. So it's about 3 years, I helped them to understand that you can make a fantastic living, you can travel. There's so much you can do. You can take care of your family adequately. You can work as many hours as you want to work. Yeah.
Okay. So looking back, as we conclude this interview, what legacy do you hope you left at Erlanger and in the Chattanooga's healthcare community? What would you think would be encouraging to others based on your legacy?
You have to want to help and understand the patient. You have to. There are often common situations, and this will be the diagnosis, but you have to deal with children who are sick, the husband that doesn't have a job, this person who's the patient, you know they drink a lot of alcohol, and you have to understand all that. And let them know, oh, we're going to take care of you anyway. And you sometimes have to talk in a language they understand. You know that it's not written on where you might tell them, okay, now you know good and well. You're diabetic. You had no better. Now you know better, don't you? Well, for now, do you know better? Yeah, I do. Okay, all right. You know, we used to encourage the girls that were pregnant, bring your boyfriend. Bring him along. Do you want him to be involved in this baby's life? Okay, when you come to the health center, bring him too. He ain't got to take a bath and all that stuff. Just bring him. And we'll talk to him, help him to understand his role. Yeah.
Okay. Well, certainly your time in healthcare has been well rewarded and probably well received, not just by yourself, but by those that you've served in the community here in Chattanooga, especially those that you work with at the health centers that I know about.
Yes.
There are people that still talk about Nurse Fred, as they call you back then.
Yeah, and still do.
And of course, we certainly appreciate the efforts and the times that you've given of service away from your family and been a part of this community, especially the healthcare community that we so well deserve. Because at the time that you came along, healthcare for African American was kind of lacking.
Right.
And you was one of those that stepped in and became part of that historical piece that was missing, and that brought us to where we are today, especially in healthcare and the hospitals that you serve, and especially places like Erlanger.
Yes.
So thank you for your service. Thank you again for allowing us to capture a little bit of your oral history here at the museum, and we certainly appreciate the things that you've given back to the community.
Well, thank you. Thank you very much.
All righty.